In this class, we'll discuss about clinical manifestations and treatment of sickle cell anemia. First, we'll talk about clinical manifestations. These clinical manifestations in sickle cell anemia will occur either because of two consequences which will cause clinical manifestations. One is due to vaso-occlusion, where there is polymerization of RBC and they cause obstruction of small vessels and they will cause symptoms. And one more consequence is it is due to intravascular hemolysis. This intravascular hemolysis releases arginase. This arginase will convert arginine into ornithine, and this helps in conversion of arginine to ornithine. And arginine is also helpful in the conversion of arginine to nitric oxide with the help of nitric oxide synthesis. But arginase will convert maximum amount of arginine to ornithine. So nitric oxide formation is decreased, and nitric oxide is a vasodilator. And other compounds which are released with the hemolysis are called as danger associated molecular patterns. They are collectively called as damps. This will scavenge nitric oxide. They will activate platelets. They decrease antioxidant activity. All these will occur, and this causes vasoconstriction because nitric oxide is decreased. That means vasodilation effect of nitric oxide is lost. So blood vessels undergo vasoconstriction, and antioxidant activity is reduced, and platelets are activated, and they will invoke an inflammatory response. Inflammation will occur. These will cause symptoms in sickle cell anemia, and we will see factors favoring polymerization. One is hypoxia. In hypoxia, this increase in 2,3-BPG occurs. What this 2,3-BPG will do? It decreases affinity of hemoglobin to oxygen. Due to this decreased affinity of hemoglobin to oxygen, they will increase polymerization, because deoxyhemoglobin will have sickle patch in sickle cell anemia, and they will have hydrophobic cavities, so they will cause sickling, and oxyhemoglobin prevents sickling. So with the increase in 2,3-BPG, there is a decreased affinity of hemoglobin to oxygen, and they will increase polymerization. And acidosis, that is decreased pH, will favor polymerization. And fourth one, increased hemoglobin concentration will also increase polymerization. These are the factors which influence polymerization. And we will see the symptoms of sickle cell anemia. First, we have to know about acute painful episodes. These will occur due to small venules obstructions. Small venule obstruction will cause decreased blood flow to connective tissue and to musculoskeletal structures. And due to decreased blood flow to these tissues will cause acute pain in those tissues, in those organs, and they will have tenderness. Fever will be present, patient will have tachycardia, and they will have anxiety also. And these acute painful episodes are most common clinical manifestations which are seen in sickle cell anemia. Most common clinical manifestation. And these acute painful episodes will last for days to weeks. And they will increase leukocytes in blood. And in acute episodes, we can see splenic sequestration crisis. What will happen in this splenic sequestration crisis? There is venous obstruction and there will be sudden massive pooling of RBC in spleen, and this decreases hemoglobin concentration in sickle cell anemia patient, and spleen will be damaged. Spleen is damaged due to acute splenic sequestration crisis. And these painful episodes, painful infarcts will occur in infarcts will occur in digits, that is fingers of palms and fingers of soles, hands and legs will be seen. So infarction in those vessels will be seen and they will cause acute pain, and this will cause hand foot syndrome. And second most common symptom which you will see, acute symptom which you will see in sickle cell anemia is acute chest syndrome. It will be like pneumonia like illness is seen. So patient will have chest pain, cough, fever, hypoxia, and pulmonary infiltrates on chest X-ray. And if these symptoms are present, then it is a major diagnostic criteria for acute chest syndrome in sickle cell anemia. If these symptoms like chest pain, cough, fever, and hypoxia with pulmonary infiltrates on chest X-ray will confirm that patient is having acute chest syndrome. So, These are the acute conditions which are seen in sickle cell anemia, and the chronic symptoms which you will see in an sickle cell anemia are divided into vaso-occlusive or infarcts one, and hemolysis causes. So we'll see with the vaso-occlusion. Symptoms of vaso-occlusion symptoms. In bone, the patient may present with aseptic necrosis of bones and joints. And this is most commonly seen in which joints? Femur and humerus. In these two bones, that is humerus head and humerus heads, there will be an aseptic necrosis, and this aseptic necrosis will cause chronic arthropathy, and patients will have osteomyelitis, infection of bone, that too with salmonella bacteria will cause osteomyelitis. Next organ is kidney. There will be renal papillary necrosis, and with this renal papillary necrosis, patient will have isothenuria. That means patient will lose ability to concentrate or dilute urine. So they can't concentrate, they can't dilute the urine. So they will have fixed specific gravity of urine. Next organ is eye. Patient in eye, retinal vessels are affected. That means patient will have hemorrhage, they will have neovascularization, and they can have retinal detachment. Retina will come out and they will have loss of vision. And spleen, they will have autosplenectomy. These are the symptoms which are seen due to vaso-occlusion. And we will see increased hemolysis clinical manifestations. Patient will have priapism, that is painful penile erection, and they will have permanent impotence. These are the two symptoms which are seen in the this priapism is seen in acute, not acute, it is seen in chronic conditions, chronic sickle cell anemia. Patient can have stroke. In childhood, the stroke will be due to infarction, and in adult it is due to hemorrhagic one. It is due to hemorrhage. In childhood it is due to infarction, in adult it is due to hemorrhage. Lungs are also affected. Patient will have pulmonary hypertension, and patient will have cor pulmonale. These are the two conditions which are seen in lungs. Patient will have cardiomegaly. Patient will have hepatomegaly. It is due to cholestasis. This cholestasis can be intravascular and extravascular. Chronic leg ulcer. It can be due to superficial. It can be superficial or deep leg ulcers will be seen. Nephropathy. In this nephropathy, patient will have proteinuria. These are the symptoms which are seen in sickle cell anemia. And we have one more condition, that is sickle cell trait. Mostly these sickle cell trait patients are asymptomatic. These sickle cell trait patients will have clinical manifestations only in hypoxia conditions. So we have to tell those sickle cell trait patients to have proper hydration and proper oxygenation so that they will have less symptoms. And most common symptom which you can see in sickle cell trait patient is hematuria. It is due to papillary necrosis. And due to papillary necrosis, patient will have isothenuria. Patients with sickle cell, HBE and sickle thalassemia, they will have milder symptoms, because these conditions will decrease polymerization. Next, we will see the treatment of sickle cell anemia. Pain episodes you have to treat with opioids. Ketorolac is contraindicated. In acute painful episodes, you have to treat the patient with opioids, and you have to give proper hydration. Next, the drugs which are used for treating sickle cell anemia patients are hydroxyurea. It is a standard care for all patients. It is recommended for all ages. It should be started early in the first year of life. What it will do? What is the mechanism of action? It induces high level of fetal hemoglobin. This fetal hemoglobin have a strong affinity. Strong affinity towards oxygen. That means polymerization decreases. This decreases polymerization, hence symptoms won't occur. If you start early in the life, patient will have acute pain. There will be a reduction in acute pain and chest syndrome. They are reduced by half. And mortality is reduced by 49%, and the dose which is given to the patient in the early first year of life is 20 milligrams per kg body weight, and this dose has to be titrated to maximal tolerated dose based on neutrophil count and platelet count. Another drug which is used for the treatment of sickle cell anemia is voxelotor. This voxelotor, what it will do, it increases affinity of hemoglobin molecule for oxygen, and it also decreases biomarkers of hemolysis, and it will also decreases polymerization. So this voxelotor is under study, and we have to know about the long term side effects with the voxelotor. And hydroxyurea will have little side effects, and it is better tolerated. Next drug is crisaniluzumab. This is a p-selectin blocking monoclonal antibody. That means this p-selectin is helpful in adhesion of sickle cell to endothelial. So it will block sickle cell endothelial adhesion, and this drug has no effect on biomarkers of hemolysis. Next drug which can be used under research is L-glutamine. This L-glutamine will decrease oxidative stress in sickle erythrocyte. This drug is under research. Next, what treatment can be offered in patients? Transfusion. Blood transfusion can be done in sickle cell anemia. There are indications for doing blood transfusion. What are these indications for blood transfusion? That is severe symptomatic anemia, for stroke patients, that is for prevention and treatment of stroke patients, to increase hemoglobin level to 10 grams per deciliter before surgery under general anesthesia. For these patients, you have to do transfusion, and in acute chest syndrome with hypoxia and multiple lobe involvement conditions, you have to do transfusion. Next treatment is stem cell transplantation. If you have proper matching, then you have to you can do stem cell transplantation, and it is a definitive cure. And gene therapy, this is under trial. We have to know about long term side effects in these gene therapy patients, and you have to do preventive measures and screening. What preventive measures you have to see, and what screening you have to do? You can do cord blood screening for sickle cell disease, and transcranial screening beginning at age of 2 years, and it is repeated annually until age of 16 years. So you have to do transcranial Doppler screening to find out stroke in these patients, in this sickle cell disease patients. Vaccination with pneumococcal vaccine, and you have to give folic acid for sickle cell disease patients. This is about clinical manifestations and treatment of sickle cell disease. This completes sickle cell anemia. Thank you.